This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Good morning and welcome to Your Health, Your Wealth with Chuck and Desiree. We come to you every Wednesday morning from 6:30 a.m. until 7:30 a.m. We're hoping that your day isn't too hectic and that you're getting to work on time, getting out of the house on time. This morning we're actually sitting down with an ENT specialist, Dr. Jha. I'm sure that's kind of like a household name here in the Cayman Islands at this time. But I'm going to go ahead and let Dr. Jha kind of introduce himself, tell us how long he's been here and how long he's been interacting with us here in this community. And I'm sure by now he's one of the Caymanian people. So let's hear from Dr. Jha. Thanks for being here with us, by the way.
Good morning, Desiree, and good morning, Cayman. My relationship in Cayman Island goes a long way. When the health services were in their very preliminary state, and we were basically a very small hospital, which is now we call HSA. And in the 80s, the doctors were hired who had ENT or surgical or any other specialist qualifications, but were not hired as the specialist. And we had to do every general practice, including the emergencies, including the ward work, including the general practice clinics, prisons, West Bay clinics, everything which is involved basically as a care provider in the Cayman Islands through the government.
That kind of sets the precedent because, I mean, you literally watch this community health-wise grow because when you're talking from the 80s, Cayman was, not to be funny, but it was kind of an outpost. It was one of those places that was literally off the radar, especially with healthcare. If there was something major, you had to be, almost flown away automatically based off of the fact that it wasn't as situated as it is now.
We didn't have the support, like the machines and whatnot, to support the conditions. Yeah, absolutely correct. That's true.
No, so you're totally right. We were two young doctors who were hired. One was myself, and there was another Dr. Lucloy. Mm-hmm. And we were the youngest of the group. And the rest of the group involved everybody else except Dr. McIntyre and Dr. Tomlinson. Mm-hmm. Okay. They are deceased. So they are still practicing. And we are the rest of the group left here, which is Dr. Lucloy and myself.
That's historical in so many connotations. Yeah. Let's backtrack a little bit. What got you into this career called medicine? What was your driving? I mean, we'll talk about Cayman, but I want to learn a little bit about you, Doctor.
Okay, well, that will take me all the way back to.
we can come back for part two, but just kind of
that takes me back to my Indian heritage. As you know, that I studied in India. My initial education, including my medical part, was all in India. Mm-hmm. So we are the family of 4 brothers and a sister. And all 3 brothers were well settled. And all of them basically either engineers or professors. Mm-hmm. So I also had an inclination towards the engineering, to be very frank. And one of my elder brother, who actually now retired as the president of Canadian Space Agency in Canada, who saw me, I had subjects which were basically engineering subjects, and the family decided at that point, we need a doctor in the family.
I like how he kind of got nudged in the correct direction,
Yeah. Exactly.
A person that practices and specializes there's another name besides ENT specialist, which is a little longer, right? It is otorhinolaryngologist, right?
Yes.
All right. A person who specializes in that field, you commonly deal with patients who actually present with like ear infections, vertigo, allergies, sleep apnea, tonsillitis, hearing loss, sinus infections, acid reflux. That's about it. And a lot of other things. A
And
lot of other things.
lot of
Okay.
other things, yeah.
All right. Tell us.
You may say that anything which is from neck and above
Okay.
can be done.
Okay. Fine.
That's a lot.
Yeah. So
that
at
is
the
a
end
lot.
of medical school, when you could specialize, what made you decide that you wanted to specialize as being an ENT
Well, so
doctor? Sorry.
I groomed in an institution where you have to really come through a merit, everything in India, and it's a very competitive environment. So you have to prove yourself at every phase. So when I came into the first 10 or 20, I think, I don't remember exactly, my position in the class of 100 was somewhere around 12 or 15. And then you have specializations, which are like 30 positions available to specialize.
Wow.
Yeah, so I had a lot of options available, surgery, orthopedics, eye, and all that. But I was actually very impressed with the professor of ear, nose, and throat.
Okay.
And that gave me a confidence that if I really worked under him, my life would be easy and I would learn plenty.
Right.
Because specialization is a gruesome environment, basically, if I really know, right? And the last thing you really want is a irritable professor. Or
Right. In
Or-
reality, when you think about it, I mean, Cayman
Yeah.
back in those days
Yeah.
would be prime for someone with your specialty field, because here was an emerging diving hub, and people were very concerned about having someone who specialized in something from, as you say, from the neck up.
yes.
You know, so it makes very logical sense that someone would reach out to you in your specialty for being here, because I mean, with the reality is that, you know, back in those days, I mean, diving, the Bob Sotos and all of those, the culture here was very dive oriented.
Yes.
Yeah. Now we've kind of switched to more that financial institution idea, but back then it was very tourism, but tourism was built basically on the backs of dive community. So having a doctor who understood those things would have been a plus, I would think, here.
Yeah.
So I'll take you back to the history of Cayman, where I don't know if anyone now remembers Dr. Paulson.
I've heard that
Has
name,
any-
yes.
So Dr. Paulson actually was very much involved in in this diving and procurement of the diving chamber.
Yes,
And
the
it used
dive
to be
chamber.
actually at one point situated in the Cayman Medical Clinic, which is on the Crew Road. So Dr. Paulson was actually actively involved in seeing those patients for the diving injuries and so forth, and going through this diving chamber therapy at that point, pressure chamber.
Yeah, the bariatric chamber.
Yeah. So those patients initially would, even if they come in the emergency, we would be directing those patients through to him to really sort them out.
Okay.
And it was more like on a voluntary basis, which is still going in the same pattern, except the chamber now is located at HSA.
Okay.
Dr. Jara, where are you located right now? Tell us where you're physically located.
Okay,
if someone wants to come in and do an
so-
appointment, or how do they get in touch with you?
So my one leg is still at HSA and other leg is at Total Health, but I'm putting my more time by providing on weekends care at the Total Health.
Okay.
So it is easier to get access if somebody is looking for a ENT appointments at the Total Health. Obviously HSA if they wish to really see me, but I think HSA has a system that they have to go through these general appointment
Right.
systems.
Time constraints
consuming, yeah.
is definitely always an issue with certain things, and it makes total sense to be able to get closer
immediate care,
access,
right, yeah.
Exactly.
You know,
So-
in Cayman too, we also have a peculiar kind of people. So we kind of like to self-diagnose, and then at the last minute, which normally happens like on a Friday night, like about 11:30, to the like on a holiday weekend, then we end up with something acutely wrong with us. Then we decide we really need to go. Yeah, we really need to go to the doctor.
That I think is a very Caribbean thing. We don't like to see doctors, but then when we do need to see them, it's almost immediate that we need to see them. So
Yeah.
it's great to be able to have access to a doctor on the weekends and be
Yes.
able to have a place and a facility that you can go to and get immediate critical and sometimes not so critical but care to that. And so thank you so much to Total Health for being able to do these
Yeah,
things.
actually, because I was groomed in the old system where we were deficient of having all the medical supporting machines and so forth, my grooming as a doctor was more history oriented.
Okay.
And that was the way we were educated also into the medicine.
Right.
And a lot of time is being consumed in taking the history. And I sometimes say the patient is the best doctor. Okay.
You know your history.
When you start taking the history, patient can really guide you, and patient basically telling you
Tell you what is already
Yeah,
wrong with them.
So that is very important as a doctor to respect the patient in that perspective and get as much as possible out of the patient about their own body. And that actually, sometimes I say, well, patient is telling me and I'm taking the credit.
Dr. Shaw, what would you say is the dangers of sitting at home until the last minute once you're feeling ill? Because if Chuck or I say out to the general public, it probably won't resound as much as somebody from a medical professional saying it to someone. Should you just be sitting at home trying to Google your whatever's going on, or what's the dangers of that, especially if you're having something like symptoms like dizziness or you're nauseated or something like that?
Okay, so my perspective of when to approach the doctor or when to approach the hospital is very simple. When a grocery store is closing on Saturday, it's not good to go like 5 minutes before when it is closing
Perfect
on, right?
illustration. That's some. I was looking
sums
for a
up
couple
reality.
of minutes, but that was literally like a couple of seconds.
That sums up our really simple but extremely accurate
Yes.
portrayal of K-Man.
Right, exactly.
Very much so.
Yeah.
We're going to take a quick break and come right back. You're listening to Healthcare Today with yours truly, Miss Desiree. My name is Chuck Taylor. Good morning to you on a beautiful Wednesday morning. We're going to take a quick break and come right back. But in the meantime, here's a little tip from our resident superstar, Lady K.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about your oral health.
Do you know someone whose dental anxiety prevents them from getting regular checkups with a dentist? I do. In fact, I have a few friends who suffer with fear, anxiety, or stress associated with going to the dentist. Being anxious about a dental visit can cause sleeplessness the night before the appointment, panic attacks, or even physical illness. Some fears are triggered by things like the sound of the drill, fear of needles, or just the idea that dentistry causes undue pain, while others may feel embarrassed or maybe they've had a bad experience that scarred them for life. Nevertheless, good oral health is vital to maintaining overall health. I'll talk about how to maintain good oral health in a minute, but first, let me give you some tips to manage dental anxiety. And now is a good time to subscribe to the channel if you haven't done so. Hit the notification bell also so you know when we have new episodes that have been uploaded. When making your dental appointment, always let the receptionist know that you have dentophobia, fear of the dentist. Ask them to make a note so that the doctor is aware even before you arrive. If your fear is overwhelming, ask if there's an option to use a mild sedative or other aid to calm you before your procedure. Once you're seated, establish a stop signal, such as maybe lifting your hand so that the dentist knows you're uncomfortable, you need to rinse, or simply need to take a break. Don't forget your earbuds so that you can listen to your favorite music to drown out the sound of the drill. Now that we've covered the fear, let's talk about the importance of oral health. Our mouths, like so many other areas of our body, has a host of bacteria, most of which can be harmless. Daily brushing, flossing, and using mouthwashes help to keep bacteria in check. Without proper care, however, gum disease, tooth decay, and halitosis, which is commonly called bad breath, can occur in your mouth. And since your mouth is the gateway to your digestive and respiratory systems, those bacteria can find their way to other organs, causing life-threatening conditions. As important as brushing, flossing, and rinsing are, dental visits are needed to clean away plaque, which build up around the gum line, prevent decay, and diagnose maladies that can only be seen on a scan or an X-ray. Plus, many diseases already weaken our immune system, which in turn makes it easier for us to become sick from common bacteria found in our mouths. The food we eat and the liquids we drink also play a part in our oral care. Acidic foods such as citrus fruits, wine, sugary sweets and drinks, pickles, sodas, all of those are harmful for your teeth. Starchy foods such as bread, chips, and candies that stick to your teeth are also particularly bad for your teeth. Alcohol makes your mouth dry, and because saliva helps to keep your mouth clean, a dry mouth is a fertile breeding ground for bacteria. Now, here are some things you can do to maintain good oral health. Eat lots of high-fiber foods. Limit snacks and wash your mouth after eating, especially foods that are on that naughty list. Brush twice and floss once daily. And if you do decide to have that dessert, then have it with your meal. Your mouth produces more saliva during the meal, and that helps to wash down those sugary particles. And last but definitely not least, drink lots of water to stay hydrated and to keep your mouth clean. The more water you drink, the more you rinse your mouth, the easier it will be for you to maintain good oral and overall health.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
I am Desiree, co-host of Your Health, Your Wealth. I'll be with you every Wednesday from 6:30 to 7:30 a.m. Your Health, Your Wealth is brought to you by BAF Insurance as a community service because at BAF, your health is our priority. Remember to stay on top of your regular health checkups because, as always, the more you know about your health, the easier it will be for you to stay healthy.
And remember also, if you missed the first half of the program, you can always catch up to what you missed on the Be Well, Be Healthy for Life YouTube channel or on a number of podcast platforms, including Spotify, Podcast Addict, and iHeartRadio. Just look for the Be Well, Be Healthy for Life on all these platforms and remember to subscribe.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
I would like to welcome to the studio Ms. Sharon Spencer of BAF Insurance. We got 3 minutes, Ms. Sharon. Now, I know this may be like rapid, but we got 3 minutes to answer as many questions as you can about the wonderful company and what they have to offer. The first question, let the timer start right now. How long has it been that you've been with BAF?
I have been with BAF for the past 15 years.
Wow, that's incredible. So you literally know everything there is to know about the company.
I believe so.
Okay. All right. With that being said, now, if you could choose one thing at BAF that stands out from all the other insurance companies for your client, what would that one thing be?
We have been in this service, serving the Caribbean for over 100 years. So we have over 100 years of experience.
That gives me a certain amount of pride knowing that this company has been around for that long and also serving the community. And serving the community through the difficult and through the fatter times in life. And of course, you know, right now we've been going through some very lean and very thoughtful. Give me a little bit of information about your health plans over there at BAF.
Well, we have individual health as well as group health. So whether you're an individual consumer or a member of your company's health insurance group, choosing BAF means putting your confidence in us to provide the highest quality health insurance plans with the highest impact on your pocket and member support services that meet all your exact requirements.
And so one of the things that I would ask if I was just hearing about the company and I wanted to take it to my HR manager.
Chuck, BAF is a specialist in the management of employee benefits. Together with our global network of partners, we have designed a best-in-breed solutions to manage employees' benefits, putting excellent employee service and employer cost reduction at the heart of everything we do. We have dedicated and knowledgeable local staff, streamlined and state-of-the-art administrative capabilities, supported by highly rated global reinsurance partners. Access care in the USA via United Healthcare, the world's largest health insurer.
Wow.
Time's up.
Time's up. So before we get out of here, let me just ask one last thing. Give me your contact details for any one of the listeners out there that want to get in contact with you.
You can contact Sharon Spencer at 327-8747 or 814-2542.
Thank you so much, Ms. Sharon. We'll be right back. Thank you for tuning in to Your Health, Your Wealth right here on Bobo 89.1 FM.
He had a speck of cloud in the right eye. So I took him to the doctor and they found out that he had congenital cataract, something he was born with. I wasn't thinking of insurance then because I thought once I'm covered, he's covered. And I learned that I needed to get him on his own. And with the help of Dr. Foley, Miss Charmaine, and the rest of the crew, they work assiduously. They help us to get through the process. The next day, my baby had an insurance. I thought for a moment that it might have taken some time for him, for the insurance company to cover him. So I started to question it, but Miss Ann Davis was helpful, and the members of the AF team, they were so helpful. They walked me through the steps, and I was a bit concerned still because I said, you can't get an insurance today. It is approved today, and then tomorrow you can use it. He was sent to Miami at Bascom Palmer, where the insurance would now be proven if it is actually true. I remember they sent me a figure. They quoted a figure to me. I have nothing near that, neither in account, neither in cash, not even in coin, and said I need to pay this money before the surgery can be performed. I didn't know where that was coming from. And I started to say, why did I pay insurance? And then this is it. I spoke with the international coordinator and she said, I have great news for you. And I looked at the phone and I stopped reading the top of the email and I saw on the bottom that it says, BAF will cover your baby 100%. So I called Miss Charmaine and I said, Miss Charmaine, the insurance company said they would cover the baby 100%. Is that true? And she said, Sunan, God works in mysterious ways. And it was then I realized that what BAF had done for my son, he was able to do that surgery. Up to this point, the only money we have paid in about 4 visits is $88. Every time I think about it, it brings tears to my eye because to know we could not afford a surgery. And for him to be seen now, because he was totally blind in the right eye. My family and I would just want to say thanks because you've given us something that we could not afford. You offer my son vision that only God could have touched this company to offer him, and everything is working perfect.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
We have persons listening from basically all over the world because, of course, we're streaming online. And it would be remiss of me to not mention that Dr. Jha's practice is actually located in the Cayman Islands, in Grand Cayman. He's already explained to us that he does quite a bit on the weekends at Total Health. And other than that, he's available at HSA. And you can get in touch, I guess, with their appointments department.
Right.
Once again, thank you for taking the time out of your very, very super busy schedule, I'm sure, to sit down and talk with us a little bit about your experience in dealing with patients and patients that present with various maladies. It's summertime.
Yeah, summertime.
We have people that suffer with allergies.
Oh, this is critical. And I wanted to talk to you about this, Dr. Jha. Cayman has... I say we are blessed with the great weather, but also allergy season comes into play. Before it used to say, okay, you know what, we had a lot of coverage but now the island is very open. I find over the recent years more allergens have been airborne, and I see a lot of people red eyes, and different things like that. Tell me a little bit about how we can protect ourselves and how you play into that also.
See, my experience in Cayman Island, though I have dealt with the allergies long time, and I have gone through the special workshops to deal with the allergies also. So if I really take you first to the history of the Cayman Island for the allergies, when I came here to find a central AC was a rarity. Okay, we even the hospital didn't have a central air conditioning, except some of the critical care rooms. That was just like 4 or 6 rooms that we had.
Yeah.
The whole outpatient was, and we didn't really. I wouldn't see too many allergy patients.
Okay.
Right? As the time gone by and we have the more preserved food or processed food environment, we have a more controlled environment, which is more like a centralized AC everywhere, including from the car all the way to the place of work to the place of living. All these three, basically, there is nothing outside. And they do participate in really adding up some sort of a reaction to the things which are not exposed. There are two kinds, like I would say, the food allergies and what we consider as the inhalants, right? Food allergy obviously is tied to something called when the load is continuously given on an everyday basis, the body does sensitize to it.
Okay.
In the older days, when the food was only available as the seasons are available,
Okay.
right? So you are automatically getting some break for certain foods, because it's not the season.
Yeah, it's not available during that time.
Yeah, but the globalization actually has allowed the food stores to have the same food all year round. And that basically adds some sort of the issues which we call as a sensitizing to the food. So that adds up to the food allergies.
So if you want mangoes all year round, or you want whatever you want all year round,
Listen
you
here,
have to put up with the allergies.
Yeah.
So it's a trade-off. So you decide.
And the thing that I see now more than ever is younger kids having more this distinct. Before you said, okay, you're having allergies was more of an adult thing. Kids were more resilient to airborne things of that nature.
Yeah.
But now I see
They're more sensitive.
Yeah,
Their bodies are more sensitive to it now.
But that seems to be the starting point of it. And then they say, oh, you've grown out of your allergies. How?
Actually,
back to what he said, right?
Yeah.
With the availability and the sensitivity that your body builds up. So I guess
so my way of explaining is that the olden days, the kings were given the poison in the amount that you can at a time, so that your body doesn't suffer, and gradually you become basically what we consider is hyposensitized.
Wow.
Okay, so your reaction to those food or elements that you are basically reacting to is not there as you thought it would happen.
Okay.
So this is the way that sometimes what we call is body goes in the remission.
Okay.
That it doesn't really react as it used to.
Okay. Can we move on to just a little bit different topic now? In recent times, you hear a lot about people having sleep apnea. So, if you have people that do a lot of active noise making in the night, then they're normally told to go see an ENT specialist. And is sleep apnea, is that in any way tied into people who suffer from allergies? Oh, and before we go on, is there tests that you can do to figure out exactly what you're allergic to?
Yeah, there are tests available. So there are different kind of tests. So food allergy testing can be done by what we call is a RAS testing. RAS testing basically allows to really find what we call as IgE levels or IgG levels in your blood. And if those levels are high against certain food, you know that there is a possibility of reacting to those foods that you are taking. The same way for inhalants and other environmental allergens, there is something called, there are different ways of testing. There is called prick testing. There is called skin endpoint titration testing. Okay, so, and also the RAS testing. So these are the three ways of testing what we consider inhalants or the airborne allergens. So those are the 3 ways we can test them. quicker way of knowing about the allergens which are in the environment is we call them the prick testing. You can just do it in the lab itself or in the clinic itself. And under the controlled environment, we can find there's a battery of the test against certain, and then we know which one you are reacting to. So that can be done.
Okay, and then the sleep apnea issue. What kind of treatments are available, like on island?
So the sleep apnea obviously is multifactorial. So to really just say that sleep apnea is first we have to find whether it is central or it is an obstructive component.
When you say obstructive, that means the airway.
Yes, there is some way there is a compromise of the airway.
And then the other one is the other dangerous one, the one where your heart kind of.
Yeah, so actually all sleep apnea, whether it's a central or obstructive, has some sort of systemic side effects. And that triggers what we call, sometimes we call it metabolic syndromes in the patient. So it triggers the blood pressure issues and so forth, or it can be making you pre-diabetic and so forth.
But I see in the recent years people spending thousands of dollars for a lot of aftermarket stuff for sleep apnea. Is it best to talk to your doctor before saying, "Oh, my"?
Let me go on the devil's page.
My husband, my devil's page. I gotta laugh at that. But my husband makes a lot of noise. He's not, he's sleeping, keeping me up at night. I'm getting them this CPAP to help sleep. Without
being properly fitted or anything.
Doing the walkthrough, because
the sleep study in the lab.
We have more money than common sense sometimes.
It's not common.
Yes, it's not common. And we jump to these things. Oh, so and so has it, so they're doing fine. I'm going to get it for my cousin, my uncle, my husband, whatever. Without actually coming and talk to somebody who can direct us on the right path.
See, every new product or every new treatment that you try to get it, think of something that if you just go solo without taking any advice or any support system, there is a highly likelihood of that device is going to find some shelf in some room and is not going to be used.
Because I've actually heard people actually saying like, "Oh, I have a CPAP machine at home or whatever. You could just what? You could just use it because I'm not using it. It's uncomfortable or what." So they literally get it and they still don't even use the apparatus to help them.
So there is an initial teething pain, and that requires a very important support system from your healthcare provider. Otherwise, more than 50% of the time, it is being procured, but it's not going to be used effectively.
Is sleep apnea an actual medical condition that can be cured or just treated?
Well, I wouldn't use the word cure, but it can be brought into the point of manageable. And once it gets to the manageable, you can cut down the side effects on the body.
Okay.
Which can unnecessarily increase your morbidity as the time goes by.
Okay. Let's talk about something that happens sometimes to children. Sometimes as an adult, it doesn't bother them. But there's sometimes when young children, they're in school and for whatever reason, they end up with a nosebleed. Or they'll wake up and they'll have would have had a nosebleed or like in their sleep or whatever. What as parents or as guardians or as adults, what would we say to a young person or anybody really? What kind of advice can you say to do the minute that you figure that you're having a nosebleed? Should you start blowing your nose? What should you do?
So in children, I will take you back to a little anatomy of the nose, and which is the commonest part of the nosebleed. There is something called anterior nosebleed or anterior epistaxis, which is normally coming from the septum itself. And the part of the septum, which is the front part of the septum, has 3 blood vessels coming in that area. And if that part of the septum is somehow injured for whatever the reasons, whether it has an infection or whether there's a child has a tendency of, rubbing nose or has allergies, underlying allergies that is causing the irritation in that part of the nose, and of causing the injury to those blood vessels, and there is a bleeding.
Okay.
But to diagnose that you have only a front part of the nose injury is kind of benign type of the bleeding. But we have to make sure that we exclude something called, which is more morbid condition, where is the posterior bleed, and there could be some sort of mass or tumor of the blood vessels which could be sitting into that area in the back of the nose. So these are the issues which are there. The treatment of the nasal bleed, which is in the front, is a easier option. It can be treated easily, but a diagnostic, basically, we have to keep in mind that we are not we have to exclude the posterior part of the nose.
Okay, so the best thing to do, like if you get the nosebleed, and I mean, probably you should just say, you know what, let it be, let's fight it right, and diagnose whether it's posterior or anterior, just so you can rule all of that out. Yeah.
Exactly.
Okay, well, now that we have summer here, or it feels like it's been here, but anyway, now that summer's here, there's a lot of swimming, people going in the pool, going in the sea, whatever. And I'm almost sure that you're going to have parents that are going to be having children with achy ears. So give us a little bit of advice.
Actually, my advice to all the ENT patients is that if you really want your sinuses to feel better, go and swim in the sea.
Okay.
But make a habit of doing it, not like once a month affair.
Okay.
That definitely helps. But the side effect of swimming in the sea, sometime it can be that it creates a ear problem, or it creates what we call a swimmer's ear.
Okay.
Swimmer's ear can also be there, those who are swimming in the swimming pool and things like those. But those are manageable conditions. And these are simple treatment. The ear canal actually should have some wax. Like you are putting on your car wax to protect the car skin. And we have a tendency of putting Q-tips in the ear to clean that wax that we naturally produce. Too much wax, obviously you will be seeing it out. Too little of wax actually is a better thing. And no wax actually is not good.
It's not a good thing. Okay.
And how to avoid those issues, you have to sometimes, I just tell them to go to the granny's recipe, so
turning your head on the side.
Put a little olive oil or two drops of olive oil. Actually,
it does. It actually does. Okay, so let's say we have a family that's gone overseas, and they've done a lot of in the pool and the water parks and everything, and their child has an ear infection. Now it's time to come home. What is the dangers of actually flying in a compressed compartment in an aircraft with probably we would call it like an inner ear infection? You can correct me, but what would happen? What are the chances of something happening to your ear?
Yeah, so most of the time it is same concept as diving injury. So when the plane goes up, most of the time you don't have any problem because you are going from high pressure to low pressure, right? But when the plane is descending, that's where you are going from low pressure to the high pressure. And that's the time if there is a tube called East-Chicken tube, if it fails to equalize your middle ear, it creates a problem in the middle ear. It's the middle ear problem. And if the ear doesn't get the air into the pocket, what it does, it basically starts pushing out the fluid into the middle ear. And that creates a painful situation.
All right. What can that actually cause any kind of like perforation of the eardrum, or no, not really?
If the drum perforates, it's actually a better option because then it is equalized and that hole being created.
It won't be the pressure will go down. Okay.
But if it doesn't perforate and if it's a severe situation, the last thing you really want to hear is inner ear. There is also what we call as a secondary tympanic membrane, or we call it round window membrane. And if there is a leak into that area, that can create sometime more problem. And that can lead to sometime a permanent hearing loss and so forth and dizziness. But that is what actually we try to exclude in the patients who have diving injuries.
Okay. Also, sometimes you'll hear someone saying like when they were actually coming back, the same thing, going from like the higher altitude descending to coming, they'll say like their face is hurting so bad, the bones in their face, and like their teeth feel like they're shaking. And what causes that kind of a...
So the same thing, like our sinuses are aerating, or the air is going into these pockets of the air in the bony components of the face. And those pockets are continuously equalizing through the nose. And if you have a cold or you had a flu like a week ago or something, and that membrane actually is swollen and doesn't provide that air,
so you can't
that
get
tube
the air,
which is equalizing from, basically failing to equalize, and now you have this almost like as if you have a...
And with that thought, we're coming kind of halfway in, halfway out of the pandemic situation that's been global. I still see people traveling on planes with face masks and things of that nature. Is that still good thought process to be on an airplane with a mouth covering like that? Even though, think of, I always say, an airline is compressed air. It's recycled compressed air, So is that a good thing or semi? Give me a little bit from a doctor's perspective on that.
What's your real opinion about traveling with face masks? Is it really necessary?
Well, it's a hard one to answer, to be very frank.
It's kind of situational.
Yeah, because statistically, we don't have big studies where it's saying that, okay, the flights, if they were all masked people or half masked people, but theoretically, it is possible that you are cutting the viral or bacterial load when you are using a mask.
Okay.
I guess we should go
among the closely sitting people and the number of the people, if it increases. So you may say the same thing, like if you are going into the club and in the nightclub and you have continuously and then you're blowing on each other.
Right.
There is a possibility that
somebody in the group
after 72 hours there would be more visit into ER of the patients.
And it's funny you should say that. Being a DJ for many years, I always walk in the club and I'll see the smoke, and I immediately we used to have it was lighted, but it was actually a air mask that we put on. Because the smoke from how they have the smoke when you walk in and CO2 and stuff like that. I was never comfortable with that. So when the pandemic thing, I already had all of my face masks from
with the filters and everything,
things like that.
All the sophisticated pieces of apparatus.
Of course, mine lit up and said DJ and all that other stuff. But I was like, wow. We didn't think about that at the time. We just wanted to not have a whole lot of smoke in my face and my throat and things of that nature. So I guess the idea is that preventative may be a little bit better than
No, I totally agree on it. And if there is a time to use the mask, one should use it. But overuse is also not considered
Thank
good.
you, Dr. Ja. That was just what I was thinking. Do you know that we're...
Listen here, New York is under smoke from Canada.
But he's talking about proper use of the mask because you know something? I've seen people with their mask in their car door and they get out and put it back on. Or it's in their bag and they're like scrabbling around in their bag and they put it back, and that is not proper use of the mask.
Understandable.
Exactly. And also it's very important that
proper use
mask is not like a multi-use most of the time. And we keep using the same.
It's called disposable.
I've seen people with it for 6 months.
The same crushed up mask.
Exactly. The reality is, you know what, we have to use common sense.
Yes.
And I think, Des always hits me, Chuck, common sense is
not common.
Right. And that happens to be a reality too. But moving forward to protect yourself, to be especially with sinuses and things of that nature. Literally, I over the weekend I had a episode of allergies hit me, and I was like, one half of my face disappeared, and I was unseen, but I could talk. But that's a reality of life now.
Yeah. Other thing is that which I tell all the patients, the few things that you can do in your lifestyle. Cardio is very important. Some sort of higher level of cardiac activity, whatever is allows you, whether you are skipping rope at home or whether you are brisk walking on the road.
Or running up the stairs to get to work.
Movement.
Because you have no elevator in your building.
Sometimes I get this answer that, I am so burdened with the work and my office, I'm so forth. I even tell them, if you are going from one desk to the other desk, please walk faster.
Movement is the key.
Enough to get your heart a little.
Right.
Brisk movement. Brisk movement basically allow your heart rate to shoot up a little.
Take the stairs every now and again.
And what it does, it releases some sort of adrenaline in your system and some sort of cortisols in your system. And those both have a beneficiary effect on the sinuses.
Okay. And I think that is an excellent point for us to take a quick break. Folks, I know you're moving from east to west and west to town and all of these things. Thank you so much for tuning in today as we talk to you about all things with your health and your wealth, brought to you by our friends over there at BAF Insurance. We'll take a quick break, 2 minutes, and come back, and we'll wrap up with Dr. Ja and ask him the big, important question. But you got to wait for that. We'll be right back.
You can check out Lady K on her Be Well, Be Healthy for Life YouTube channel. Her podcast, Be Well, Be Healthy for Life, is sponsored by BAF Global Group, and episodes are released weekly on the BAF Facebook page, as well as on Spotify, TuneIn, iHeartRadio, Podcast, and Podbean. Over to you, Lady K.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about common food allergies.
Reactions to food are not uncommon. For many people, dairy products cause intestinal distress, beans give gas, and curry causes a stomach ache. As uncomfortable as these reactions are, they're not caused by the immune system and are therefore classified as food sensitivities or intolerances, not food allergies. Now is a good time to subscribe to the channel if you haven't done so. Hit the notification bell also so you know when we have new episodes that have been uploaded. When you're eating something that you're allergic to, your immune system mistakes it for something that could make you ill, and it immediately mounts a response. It could be as simple as itchy eyes, or a skin rash, or as serious as trouble breathing and swallowing. It could be swelling of the lips or the tongue, tingling inside of the mouth, and even sudden itching in the ears. These can all be signs of an allergic reaction. Although almost any food can cause an allergic reaction, some foods are more common than others. More than 80% of all food allergies are caused by milk, eggs, peanuts, tree nuts, soy, wheat, which contains gluten, fish, and shellfish. Allergic reactions can happen within minutes, or it can take much longer, which makes it harder to identify. It's important to note that allergies can develop at any stage of life. For example, milk and dairy allergies tend to be more prevalent in children, and many of them outgrow those allergies over time. However, some people report developing dairy allergies in their adult years. In many cases where the reactions are mild, it can take years for you to determine exactly what foods you're allergic to. Plus, there can be hidden ingredients that trigger allergic reactions, such as eggs or wheat flour in cakes, or items that are packed in factories that also pack peanuts. Read labels before you buy and seek medical help. A medical professional can order an allergy screening that tests a variety of foods and food groups to determine what triggers your allergic response. If you begin gasping for air or you have a hard time swallowing after eating anything, get medical attention immediately. Quick action saves lives. For less severe symptoms such as rashes, then over-the-counter antihistamines and anti-itch creams may suffice. Regardless of the severity, however, it's important to seek medical attention. In the meantime, you can help yourself by keeping a simple food and symptom diary. Each day, write down everything you eat and drink and any reactions you have. Include everything you eat or drink, including snacks, for 2 weeks, and then examine it carefully. You may be surprised that the food you love the most, or a single ingredient, is the one that's causing the most problems. Begin eliminating foods and keeping a record of that as well. The first time you have a reaction, eliminate that item from your diet for at least 2 weeks. Keep eliminating foods that cause allergic reactions until you're left with the ones that don't. Then take your food diary and everything you've written with you to your medical practitioner. Food allergies can be dangerous, so take them seriously and get medical help.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance, plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Thank you so much, Lady K, for your tips about being safe. It's always great to be reminded about these information.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Hey, Des, do you know what time it is?
What time is it?
It's that time when we reach out to one of our wonderful representatives from BAF, and they tell us all the wonderful things about the company. We have Miss Ann this morning.
First question. What do you do at BAF Insurance?
I am the supervisor at BAF Insurance. I manage the daily administrative function and customer service.
If you could choose one thing that makes BAF stand out from the other insurance companies for your clients, what would that one thing be?
We provide exceptional customer service to all our clients, irrespective of the level of service required.
When someone applies for health insurance with BAF, how long does it take for them to be approved and for the insurance to become effective?
Our turnaround time for approval is 3 to 5 business days. If the policy is approved between the 1st to the 15th of the month, the policy becomes effective the 1st of that month. If it's after the 15th, then it becomes effective the 1st of the following month.
So tell me a little bit now about the claims process. If I have a BAF health insurance plan and I make a claim, how quickly can I expect to have my claim settled?
The turnaround time for claim settlement is 3 to 5 business days, provided that the claim form is filled out with the correct information. We also have an online portal through which providers can submit their claims, which help to make the process a lot more efficient.
And Miss Ann, if someone wanted to get in contact with you, how would they be able to do that?
You can call us at 949-5089, or my direct number is 814-2522.
Great. Time's up, Ann. If you're just joining us, you're listening to Your Health, Your Wealth with Desiree and Chuck on Bobo Radio. We're here with you until 7:30 a.m. with a host of health tips and information, as well as a special guest to help you and your loved ones live healthier, happier lives.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
I am Desiree, co-host of Your Health, Your Wealth. I'll be with you every Wednesday from 6:30 to 7:30 a.m. Your Health, Your Wealth is brought to you by BAF Insurance as a community service because at BAF, your health is our priority. Remember to stay on top of your regular health checkups because, as always, the more you know about your health, the easier it will be for you to stay healthy.
And remember also, if you missed the first half of the program, you can always catch up to what you missed on the Be Well, Be Healthy for Life YouTube channel or on a number of podcast platforms, including Spotify, Podcast Addict, and iHeartRadio. Just look for the Be Well, Be Healthy for Life on all these platforms and remember to subscribe.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
So welcome back to Your Health, Your Wealth, brought to you by BAF Insurance. We're with Dr. Jha this morning, and we're talking about all things ENT. So basically, he's explained to us earlier that means he deals with any conditions from the neck up. So now we're going to ask one last question before we thank you for coming in and spending this time with us, this most enjoyable time with us. We're going to ask, what keeps you motivated?
Well, motivation for me, obviously you can't put me in the young group anymore, but you can put me in the elderly group now.
Okay.
But my motivation at this point is, in life I always say myself, I want to die like a student. And the way once you become sedentary, you basically have to stop living. So that is my motivation in life for everything. I have a curious mind, and when the patients are in front of me, that curious mind gets very active. And I dig into the patients every way possible to really find the right answer. Not only that, I feel that I have commitment to the country who has provided me the stage to really prosper. And I'm very thankful about that because my family groomed here, my children groomed here. One of them, they are well settled. One is a lawyer, other is a doctor and all that. And so my motivation in Cayman Island will persist. Whatever way I can provide, whatever I have learned, and whatever the experience has really given me, I want to give back to the community.
Excellent. Excellent.
Yeah.
And with that, Dr. Jha, I will tell you from someone who you have looked after and family members over the years. We have been very grateful and thankful for who you are, for what you have bring to the table here in the Cayman Islands.
Yeah.
Thank you very much.
From many moons, I will say. Thank you so much for all your community work and just being you. We thank you for that.
Well, because I grew up in a community, I would consider at that point it was a small community, right? And everybody kind of know everyone.
Mm-hmm.
And their pain became my pain those days. This is how we really consider, right? And whatever the way we could really support the patient, that was the motive basically.
Excellent.
And that has entrenched quite deep into me when I'm seeing somebody and suffering. I do not really separate myself as a patient or the doctor. I basically become part of that, whatever the way I can assist the family or the patient. That's my goal.
Perfect. And just a reminder before we get out of here, if someone wants to get in contact with you in your office, how can they reach out to you?
So if someone wants to come in, like Chuck said, the number to call would be for Total Health. It's 333-2222.
Right. And then you can reach out with Dr. Jai and get connected with Total Health over there.
And they'll make some appointments
and
for
they're,
you.
they're literally open 24 hours, 7 days a week, 365.
You guys open like all?
They're literally just a phone
and
call
they have
away.
a pharmacy as well.
And a pharmacy as well.
Yeah, which works out really well. But if you have a prescription and you decided to undiagnose yourself, diagnose yourself.
Only Des, I tell you. You and Dr. Google, we could have a conversation about that.
Just a little one.
Folks, thank you so much, Dr. Ja. As always, it's a pleasure. Thank you so much for being here today with us.
I enjoyed being here.
Thank you.
And going in the history of the medicine.
Yes. So we'll definitely have you back another time.
Oh, yeah.
Because we know that you're not only just the ENT specialist, he's actually acted in the capacity of like a surgeon, a GP, whatever, everything.
Yes. And that is what I want to say is that I really look at the patient as a total.
Yes.
When a patient coming in with the ENT complaint, I even look at the general aspect of that patient, and that helps me a lot.
Yes.
Excellent.
Yes.
Perfect.
Thank you so much for being here with us. Thanks.
And thank you all.
Well, that's our show. Remember to check out Lady K's videos on the Be Well, Be Healthy for Life channel on YouTube or Spotify, iHeartRadio, TuneIn, Podcast Addict, or Podbean. Just look for the Be Well, Be Healthy for Life channel.
And don't forget to subscribe, like, and share with your friends. Those videos are life-saving health tips brought to you free by BAF Insurance. The YouTube channel is Be Well, Be Healthy for Life, and you can also catch up on Your Health, Your Wealth shows that you missed at the same time. Until next week, we are Desiree and Chuck, encouraging you to start now to live a healthier, happier life.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.